Well, as we've been reporting this morning, the NICD says the COVID-19 test positivity rate in the country now stands at 34.9%, which is around 7 times the rate at which the spread of the virus is considered to be under control. This as 23,884 new infections and 24 deaths have been recorded in the latest 24-hour reporting period. The increasing infections have brought about concerns that the country could be placed on tighter lockdown restrictions following a meeting of the National Coronavirus Command Council that was chaired by Deputy President David Mabuza yesterday. Mabuza was representing President Cyril Ramaphosa, who is currently recovering after having contracted the virus. For more on the status of the virus in the country, we are joined by Dr Mvuyisi Mzukwa, who is the Vice-Chairperson of the South African Medical Association. Dr Mzukwa, great to have you. Thanks very, very much for being with us.
Good morning, Leon and Sakina. Thanks for having me in your legendary program.
It's an absolute pleasure, and we really do appreciate your time. We watch those numbers, and these numbers just seem to be increasing. In fact, it's just one of those, people start thinking, okay, looks like we may be turning down, and then suddenly there's another massive spike. What are you reading into Omicron? Where are we at the moment?
Well, what we see now, Leon, is that we are having lots of community spread. As you have noted, we are now sitting at a positivity rate of about 35%. So this is very important to say that it looks like there's something that's happening in the community, whether we are ignoring the non-pharmaceutical interventions, where we're not wearing our mask, we are gathering in large numbers, in closed doors, and all those things. I think that's what we see at the moment. But on top of that, we don't see any admissions, to that rate at this point in time. I mean, it's only 3 weeks of this Omicron variant, so it would be dangerous for me to say that it doesn't cause severe illnesses.
Yeah. That's I think what a lot of people are looking at and asking and saying, the word out there appears that this is a much milder version. We're not seeing the hospitals fill up at the rate of the previous waves that we've experienced here in the country, and that there's not too much alarm about this one. I know it's 3 weeks in, and I do understand that that's the messaging, but from the data, from what you're seeing, would you say this is a correct analysis at this point in time, what we've been looking at so far?
I think there is a consensus. If you look at the data that comes from the NICD, which is a branch of the NHLS, and also what comes out of National Department of Health, but also recently the Discovery Health study that came out, analyzing the impact of Omicron in the real world sense. So I do think that we have information that really talks to the same issue, that so far we see that this is easily transmissible, looking at the positivity rate, but also what we see is that it looks like we also have a higher number of admissions when it comes to children as well. But overall, if you compare severity in children and the adult population, there's nothing. It's still a low if you compare the two. But on top of that, we note the reinfection rate that has come out as well. Is sitting at around 40%. It means if you were infected with COVID before, you are standing another chance of about 40% of getting another bout of COVID-19 infection. But also what is notable is that there is still around about 70% chances of you of not being admitted if you are vaccinated. I mean, the protections are sitting around 70%, but it comes a little bit lower down if you are, sitting at those elderly populations at around above 70 years of age. So we're seeing those trends at the moment.
Yeah. So the vaccination rate that we're going at, I mean, it's still nowhere near what I imagine the President and the Medical Association had wanted to see, because we keep being told that the only protection against this is to go and get vaccinated. However, even in the middle of a fourth wave, we're not seeing those numbers of, let's say, 300,000 a day, something that had been hoped. In fact, we have now an oversupply of vaccinations. Are you still concerned about the lack of uptake by South Africans with regard to vaccinations?
It is still concerning, Leanne, because, look, there are people who are really at risk who might contract COVID-19. But also we know that if we are not vaccinated, we stand a chance of getting another variant. We don't know how severe that variant will be in terms of illnesses. So it's important that we get vaccinated so that we go back to our normal lives, or the new normal, so they call it. It is important, though, that we must protect ourselves and the communities around us. These vaccines so far have been seen, we've noted that they protect against a severe disease. It's clear the data is out there. So it's very important that we encourage, from all sectors of society, churches involved, also the non-governmental organizations, all the leaders in society. I think they need to encourage society to go out there, have the vaccines, because as you said, we don't have a shortage of vaccines in the country. We must use I'm afraid if we don't use these vaccines and they get to a point where we throw them in the drain because they're expired, it will be a waste of South Africa's taxpayers' money.
Let's have a look at where we're at right now in terms of hospitalizations, and obviously the National Command Council meeting and trying to discuss whether we should implement stricter lockdowns or measures just to try and stop the spread. Because as we mentioned at the beginning of the interview, we are seeing the positivity rate at very high levels. I mean, these levels are exceptionally high, even though what we've spoken about, perhaps it's not as, it's a milder case, not as hard to deal with as previous ones from early research. However, we are seeing the hospital rates. Let's talk to that, because I see that there's about 6,895 people, according to the latest data. This is up 697 in the day that have been admitted into hospital. ICU, 469 people. That's 49 people up. Ventilated, 187. That's 20 people. I mean, these numbers that we're looking at, do they, at this point, justify the fact that we need to go into a stricter lockdown or not?
Well, Leanne, I do think that we need to be careful, with these lockdowns, because they don't really translate to lower community spread. Perhaps we could look at in the numbers where people are gathered indoors. Maybe that's where we need to, really do something about. But the rest of restrictions, I don't think they've done any good to society in terms of curbing, the spread of the virus. I mean, look at what has happened with the international world. When we had the Omicron, everybody closed borders and said, no, South Africa, don't come to us. But today, more than 23 countries have got Omicron. So, these restrictions, honestly, if you look at the previous waves, we have had so many of these restrictions. They are not properly implemented. There's nobody to monitor it. It's not helping at all.
I mean, it is at this point. I mean, we've got, 750 people allowed indoors, 2,000 outdoors, a midnight curfew. I'm not sure if any of these things are being implemented right now. So, by making further restrictions, I suppose you're right. This is who polices them anyway? And over the festive season, it's exceptionally difficult. I remember sitting here this time last year, again seeing these harder restrictions, beaches being closed, people not being allowed to be doing these kind of things. I mean, do you think something like that can actually happen again? Because there's a great fear and uncertainty amongst South Africans that could be the direction we're going in, or, Do you think not this time? It doesn't warrant it?
Then looking at the picture that we have, the clinical picture that we have now, I mean, where we have lower rates of hospitalization, and also there are other issues. I mean, we know that most people in South Africa have been exposed to the virus before, so there's lots of circulating antibodies in the communities. But on top of that, there's also the issue of vaccination. If we look at the rate of admission, we don't believe that we should be going that stricter in terms of, curbing this. It's not helping. On the other side, if you look, the livelihoods of people have been affected. I mean, if you see at the moment, we're dealing with what we think it's not a very severe form of infection. There will be no justification at all to go into stricter lockdowns and closing beaches and all those things.
Yeah.
And also beaches, you must remember, Leanne, those are outdoors activities. Unlike if you have those indoors where you have about 750, I think that's the only thing that we can do to restrict the indoor gatherings.
Instead of having thousands of people running into shopping centres and closed environments, which we saw happening last year. Just very quickly before I let you go, one or two more questions. Just anything your sources are telling you, do you think will be addressed as a nation anytime soon this week? Do you have any intel into that?
It is possible. I think government needs to talk to the people.
Yeah.
We need to know people, they've got plans. They need to know if there's any further restrictions as far as the festive season is concerned.
Yeah.
But as I said, there's no need for stricter lockdowns.
Yeah, indeed, people do need to know, and businesses as well, particularly, I imagine, tourist establishments and the alcohol industry. There's also the issue of the Russian scientists that have arrived here in South Africa, again from the South African Medical Association. I just want to get your views into this. They are here. It's being said that they're here to study alongside South African scientists the Omicron variant. But there's a lot of suspicion around this visit as well. Do you know much about this visit, that they're coming into South Africa? Some are speculating it could be about trying to fast-track a Russian vaccine. Some people saying it's trying to get data that they may not be able to or should be having access to. Talk to us about this. Do you know much about this trip?
Well, then, to be honest, we don't know much about this trip. All we know is that there was an arrangement between the presidents, Ramaphosa and Putin. Also, we understand that they are coming here to work together, collaborate with our South African scientists. But also, we know that there are those dynamics between what has happened now between us and the global north. But also, the issue that you have raised now is the issue about SABRA not approving, their vaccine. They might want to understand it, closer, that which issues that are at play at the moment. You would want to know how did we come to that decision. I think they want to interact with our scientists. But there might be something more than what I'm saying.
Yeah.
I'm just speculating.
Indeed, and I think everybody is right now. That's where we're at. And then I'm going to let you go after this question, because I know our big story is, of course, that COVID numbers that are pretty high at this point in time. I mean, yesterday reporting 23,884 and a lot more tested. 500 Rand for a PCR. Is that fair? I mean, bringing it down from 850 to 500. I want to get your comment on this, because I think there's still a lot of suspicions out there that someone's making money in places they shouldn't be making money, that these tests are still too pricey for the average South African, and it should be cheaper. From the South African Medical Association, what do you say?
Well, I think we welcome the fact that the price has gone down from 850 to 500, but there's still room for improvement. But what we need to insist is that there's the Council for Medical Schemes, which should be assisting and fighting on behalf of society. Those that are covered, even those that are not covered. I mean, this is very important. We're in the middle of a pandemic. I agree with you. We should not be making any profit during a pandemic. I mean, we have seen with also some big pharmaceutical companies who have come, under scrutiny. And it was really a disgrace to have such companies benefiting during a pandemic.
Yeah, indeed. And the problem is so many people are getting rich, and that goes without say. A lot of people have profited on this pandemic. I mean, if you have, as we wrap it up, thank you very much, Doctor. I mean, I just did a quick calculation. If you looked at the tests that were done yesterday, if we were still sitting at that 850 mark, do you know that just from the tests yesterday, it was 58,171,000 rand that was made off just testing yesterday. That's it, just one day. And you know how far we are into this pandemic. Anyway, so yeah, still lots of money being made there. All right, I know it's late. It's 3 minutes past.